Welcome to Feminist Fridays on Mornings with Zerlina.
Welcome back to Mornings with Zerlina, our continuing coverage of Black Maternal Health Week. We will be chatting with Dr. Jamila Taylor, President and CEO of the Institute for Women's Policy Research. Good morning. Thank you so much for being here, Dr. Taylor. I have a lot of questions for you.
Good morning. Thank you so much for having me and for covering Black Maternal Health Week.
So we've been talking about it all week long, and there's a stat that comes up in every conversation, which is Black women are 3 times more likely to die compared to white women from pregnancy-related causes. And that's just a headline that we've seen for many, many years now. Why is that the stat? And why hasn't it changed? What are some of the causes that you've identified in your research?
Yeah, absolutely. Well, first off, I think the top line is that, the reason why Black women continue to see such high rates of maternal mortality and, quite frankly, morbidity in this country is due to policy failures, first and foremost. But also at the same time, we have to take a step back and look at how women generally are treated within the healthcare system. Over the last several years, we have seen more families shed a spotlight on what mothers have experienced when it comes to childbirth in the United States. And some of those stories are focused on being in healthcare systems and hospitals who have ignored their pain and discomfort in the process of childbirth. But also, I think, coming back to the policy failures piece, looking at issues like a lack of access to affordable health care, ensuring that health care is integrated and centers the woman and the family as opposed to the medical establishment. So those are just some of the issues that crash the surface. I think also at IWPR, we have really been focused on, in the past couple of years, taking a step back and looking at the economic implications as well, and thinking about what happens to a Black family or even the community when moms are lost due to these preventable deaths. And so those are just some of the issues that are connected to why we see Black women dying at higher rates. And then last but certainly not least, we can't forget the issue around racism and inequality. And again, we see this both in our policies and how they're implemented, as well as how women are treated in the healthcare system.
Talk a bit more about that, because I think when people maybe see a headline that says Black women 3 times more likely to die,
Mhm.
unfortunately, some people see that headline as maybe a problem of medical care or biology, right?
Mhm.
Like there's
Yeah.
there might be something about Black women that makes them uniquely more likely to die.
Mhm.
But that's not what's happening. It's actually structural racism. So help us understand why it's not a problem of biology. It's a problem of we're not being treated the same way when we're actually in the hospital, or we're not actually given the same access to the care that we need.
Yeah, absolutely. And I do want to say too that the perception around, linking some of these public health challenges, particularly when they are targeted and sort of we focus on the Black community, there is this blame associated with these issues, right? And so even just thinking about how Black folks are treated in the healthcare system. The perception that, we have thicker skin and we have higher pain tolerance, those perspectives in and of themselves are racist, and they have been around for centuries. And it is important for us to take a step back and unpack that and call it what it is. So that is a part of the dialogue, absolutely. And we see that again, this issue has been documented very well over the past, decade or so. And we have also had the opportunity to hear from women and hear about their experiences. Even celebrities like Serena Williams and even Beyonce have shared their own stories, as famous women, celebrities who have had challenges in the healthcare system when it came to not being listened to. And so that is definitely a key aspect of this. And I also just want to say, too, in terms of the data, the data is getting better. And so, again, that's really important for us to be able to illuminate, what women are experiencing when it comes to this issue. But again, these are preventable deaths. More than 80% of these deaths are preventable. And so it's time for us to take a step back and really think about how we can move forward and address it in a way that is proactive and that makes sense and centers families and moms at the same time.
How has Dobbs made it worse?
Yes, Dobbs has definitely made it worse. First off, over since Dobbs, we have heard stories of women, particularly concentrated in the South, where we see very restrictive abortion bans, where women who were turned away from care and they weren't able to get emergency pregnancy-related care for any host of reasons pass away, due to these abortion restrictions. And there's also been research, actually, when we knew that Dobbs was on the horizon, there was research done by the University of Colorado Boulder that had warned us that if we see some type of national abortion ban, that we were going to see our maternal mortality rates increase. So it's still too early to have, I think, a broader view of, sort of what the connections are and how Dobbs has impacted maternal mortality by the numbers, but we certainly have heard stories over the past couple of years of women trying to access emergency obstetric care and were turned away and they lost their lives.
And when you think about the moment that we're living in right now, there's an opportunity, and Black Maternal Health Week gives us this opportunity to talk about some of the policies that this administration has put into place that have made the issue worse, not just Dobbs and the consequences of Dobbs, but also the consequences of the big, ugly bill that cut millions of dollars, billions of dollars from Medicaid and how that impacts people. So talk a bit about this phenomenon of maternal health deserts and the consequences of something like the big ugly bill, which cuts Medicaid, and how that impacts maternal health.
Yes, absolutely. So I first want to say that the one big ugly bill, I'm going to use your words, actually cut $1.4 trillion, so not billion, trillion dollars from healthcare, food assistance, and education programs, all to provide tax cuts for the wealthy. And Medicaid is definitely a key aspect of, this legislation and a key area where significant funding was cut. For those who are listening who may not know, Medicaid is a publicly funded program that largely supports people with low and middle incomes with health insurance coverage, right? And so we also know that Medicaid disproportionately covers Black women's births, at the tune of about 60%, but also Medicaid covers about 40% of all births in the country. So this is really an essential, not just policy lever, but program that is covering women and families across the country. And so if you think about setting that in the context of something like, the maternal health crisis, that is really problematic for our country. And then I'll also say too, in addition to that, we also saw in President Trump's recent FY27 budget request that there were also deep cuts to crucial programs like the Healthy Start program and the CDC's Safe Motherhood Initiative. So again, there's this pattern that we're seeing in terms of cuts to essential programs that are really helping moms and families be healthy, make ends meet, live, productive lives that are on the chopping block. And then lastly, I know you mentioned maternity care deserts. Yeah. This is also, a major issue when it comes to the maternal health crisis. Maternity care deserts are, across the country. Based on research by the March of Dimes, we know that over a third of U.S. counties are already maternity care deserts. So that means for women and families that live in those areas, they don't have access to quality health centers and hospitals that could treat them for, any host of issues that come up, or even to just have the prenatal care and healthcare that they need leading up to a pregnancy, during a pregnancy, or after a pregnancy.
Right.
So that in and of itself is a challenge. You add that on top of the fact that we're experiencing these drastic cuts to health insurance coverage, food assistance. We didn't even get a chance to talk about unemployment and Black women in this
Yeah.
country, which, I speak about in the Essence piece that I wrote, and how that is going to have an impact. So it really is time for us to take a step back and think about how we need to move this issue forward. And then lastly, I'll just say, this shouldn't be based on, politics and who's in the White House or who's in Congress. Everyone in this country should care deeply about the lives of moms and babies. And it's time that we be real about what it takes to address this issue once and for all.
It's like there's no access to contraception
Mhm.
to allow people to plan. Then there's no health care before, during, and after, depending upon where you live. You might lose your job because of the cuts the administration has put into place, or DEI, getting rid of DEI, so you're a Black woman losing your job. Then there are no resources in your community to help you raise the kid. I mean, it's just like you're feeling it from all sides, and all of these things are connected to one another. Nothing exists in a silo. Dr. Jamila Taylor, President and CEO of the Institute for Women's Policy Research, thank you so much for closing out our week-long coverage of Black Maternal Health Week. It was great having you here this morning.
Thank you so much for having me.
We're going to take a very quick break, and we're going to talk about the Iran war with Harrison Mann, Associate Director for Policy and Campaigns at Win Without War. That conversation is coming up next.